Well, hey, everybody, this is Robert, and welcome to Outbreak News Interviews. Now, Bangladesh is battling to control its most devastating dengue fever outbreak recorded since dengue fever reappeared in the country in 2000. Although dengue is endemic in Bangladesh, this year's outbreak is unusual in terms of case burden, mortality, and seasonality. This record season, and I'll show it to you right now, um, has seen more than 250,000 cases to date. That's more than 250,000 cases, including a global leading. As far as I can tell, no country has this many fatalities, 1,255 um, dengue-related fatalities. Now, both numbers are easily um, much higher than previous records that Bangladesh has ever seen significantly. So, what is the on the ground situation in Bangladesh? Why is it so bad this year? And what is being done to get the epidemic under control? Well, today's guest will shed some light on the record breaking dengue outbreak of 2023. Joining me today is Dr. Mohammed Rafiul Hasan. Dr. Hasan is with the Government Health Department of Bangladesh. He's a field epidemiologist, and he is actively involved in working to manage the dengue outbreak. Dr. Hasan, welcome to the show, sir.
Thank you, Robert. Good
Okay, so
morning. Good
good.
morning from Bangladesh and good
Yes,
evening for the people from USA.
yes, sir. I am speaking to Dr. Hasan from Dhaka. Are you in
Yeah,
Dhaka today? Yes.
yeah. At this moment, I
And
am in Dhaka.
yeah, so we have a 10-hour time differential. Um, Dr. Hasan, can you go ahead and start? Now, my audience has heard about dengue fever many times on the podcast, but just as a reminder, can you go over a summary of dengue fever, the transmission and the pathology and the treatment, et cetera, et cetera?
Okay, first I want to introduce Bangladesh for your audience. You know Bangladesh is a country in the Southeast Asia, and it is on the curve of the Bay of Bengal, and it's has a climate. You can say we have a climate which is corresponds with the monsoon and which is high temperature and high rainfall in the rainy season, and this is very suitable for the breeding of the Aedes mosquito. And in Bangladesh, basically we find two types of mosquito: Aedes aegypti and Aedes albopictus. And dengue is spread mostly by Aedes aegypti. Typically, it lives in the town or in the municipalities. But nowadays, we are getting this mosquito even in the remote areas of Bangladesh. And what you already mentioned, dengue was first diagnosed in Bangladesh in 1960s, particularly in 1964 to 1966. There were some patients diagnosed with unknown fever, and after some treatment or diagnosis they got improved, but there were high fatality rate also. And at that time this fever was termed as Dhaka fever, and later it was found that this was happening due to dengue virus. And later it was found that the virus was spread by the mosquito Aedes aegypti. And what you have already told, I am just telling the latest information of yesterday. There were 2,484 patients are treated in different hospitals, and the new furthermore 2,056 patients were admitted, and there were 9 deaths in this time. And since January, we have found that there are total 1,255 deaths. I'm sorry, it's a very early morning in Bangladesh, and uh, it's comparatively cold today. And you know very well that Bangladesh was facing dengue every year since 1960s, but the number was not that much high. But since 2000, there was dramatical change in the dengue cases of Bangladesh. In 2000, there were hospitalized cases around more than 5,000, and there was 93 deaths. The case fatality rate was high, 1.67. In the next year, there was also some deaths and cases like 2,430, and the case fatality rate was also high with 44 death tolls. And there was more or less around 4 or 5,000 cases from 2000 up to 2018. In 2008, in 2019, there was a great national level outbreak, and it caused around more than 1 lakh cases, and the death was not that much comparatively high. It was around 180, but death became high in 2022. Though there was only 60,000 cases, but there was 281 deaths. But everything got changed, particularly in 2023. We have outnumbered cases, and the total case number since January of 2023 is 255,000, and the death is 1,255. Yes, it's a matter of question. Why this sudden rise? Why this sudden rise of deaths, sudden rise of cases in Bangladesh? You know, climate change is a major factor here. Uh, Worldwide, the temperature is rising, and this is also same in Bangladesh. And the more important fact is that the rainfall timing is also changing. And Bangladesh, you know, Bangladesh is a very small country with a high population. While you are considering the area, Bangladesh is 19th in the world. But while considering the population, it's ninth. And as Bangladesh is developing economic financially, so the movement of the people has increased more and more. And nowadays, people are moving from the one part of the country to the another part every day. So the mosquitoes are transported throughout the country also. And you know, the urbanization has become a prominent factor in Bangladesh. More or less all over the country, the urban areas are increasing, and the rural areas are decreasing. And people are moving towards urban areas more and more. So the population density in urban areas are also high. For this reason, uh, the with the economic development, urbanization, heavy rainfall, uh, temperature rise, climate change, all are creating a suitable environment for the spreading of Aedes mosquito. Moreover, the awareness of people is on that much high, which was essential for, you can say, containment of the disease or mosquito. So we can say that these are the background factors for increasing the death and cases in Bangladesh.
So, what um, what dengue strains are circulating in Bangladesh this year?
Okay, you might have heard the name of Institute of Epidemiology Disease Control. Sorry, Institute of Epidemiology Disease Control and Research (IEDCR) of Bangladesh. This institute always this institute is responsible for the testing of the serotypes of the dengue. And nowadays we find that dengue virus serotype 3 and serotype 2, those are prominent in Bangladesh.
Now, concerning the death toll this year, which is about a 300% increase compared to the previous record, um, why do you believe the dengue death rate is so bad this year as compared to previous years?
Okay, in fact this is not 300%, this is more than 600% in Bangladesh, previous comparing to previous year, because previous year this was around 200, and this year in 2022 it was 281 as far I can recall. Just give me a minute, I have the document. Yeah, this is 281, and this year this has already crossed 1200. So there is really a question why this is this high rate of dengue. There are some specific reasons. Number one, in previous years, the dengue deaths were reviewed, and only the confirmed deaths of dengue, those were confirmed by the board, those are mentioned as dengue death. But this year, as the death rate is too much high, so it's very hard for the health system of Bangladesh to review all the deaths. So all the reported deaths who are admitted in the hospital as dengue fever are reported as dengue deaths. So number one, this one is a matter of counting, we can say. Second, as the case number is too much high, so the death numbers will be high proportionately. It's very normal. If we can look at the case fatality rate, we can see that the case fatality rate is more or less same in 2022, in 2000 or previous years. And another more thing, Bangladesh is a country that is not that much rich or developed, and people this year are affected by dengue even at the rural regions or out of Dhaka. Though health system of Dhaka is very developed, and you can say they are experienced for fighting with dengue, but out of Dhaka, the health system is not that much experienced or not prepared for dengue treatment. The government and the Director General of Health Services of Bangladesh and Health Ministry all are working very hard, but it's not possible to prepare a health system, particularly in such a large outbreak, within some months. So patients are referred from outside of Dhaka to Dhaka, and the health system of Dhaka got overwhelmed. There were more than 500, even 100% increase of the patients in some hospitals. So it was near to impossible for the health professionals and other staffs to support all the patients. Moreover, we have some crisis of ICU also, as this is very sophisticated system. So there are not adequate human resource for the treatment of patients, and I particularly in ICU.
Mhm.
This also causes some deaths, and moreover, this this year this is the main factor. This year, the presentation of dengue has changed from the previous years. Previously, we knew that dengue was termed as a breakbone fever. You can say there was huge headache, huge body ache, and high temperature. And though this is already recorded worldwide, dengue patients' condition falls after the uh, you can say solving the problem of fever. When the temperature normalizes, then the patient uh, condition may be serious. But this is not the feelings of the people. People feel that when I have got recovered from the fever, then I have also recovered from the dengue. So I don't have need to be aware about my physical condition, or for don't need to go to doctor or hospital immediately because I have already recovered from the dengue. But you know, dengue shock syndrome or severe dengue normally occurs after being recovered from the fever. So this awareness is on up to the level among the mass people. As a result, when they are coming to hospital, they are already in the decompensated or compensatory level of shock. And you know, when someone is in shock, then it's very hard for anyone from any place of the world to treat him, to recover him. But you know, we have a high and higher recovery rate. Most of the patients are being recovered, like 99.5% people are being recovered at the different hospitals of Bangladesh. So the it's true that the number of the deaths are high, but I will say that the government, the health system, and the physicians, the health workforce, all are working their level best to treat the patients.
So, Dr. Hassan, one of your roles currently is the management of this dengue epidemic, and health authorities and the government and yourself. What's being done to get this epidemic under control?
Okay. In fact, from the very beginning of this outbreak, government, our health system, and including me, we are working for controlling this epidemic. This outbreak, this large outbreak, we can say.
Mhm.
Particularly, government has done three things. Number one, there are some awareness programs at all over Bangladesh by the local government and the health system. In the second, the health system, the Ministry of Health, and the Director General of Health Services of Bangladesh, they have they are training the doctors. They have increased the beds for the dengue patients. They have dedicated some hospitals for the dengue treatment. And thirdly, local government and the health system, we are taking some steps for controlling the spread of Aedes. There are some measures for controlling the mosquitoes. They are spreading some insecticides all over the country, particularly in Dhaka and the cities where the dengue cases are high.
Mhm.
And though we are trying for some advanced management for the control of Aedes, like the genetically modified some mosquitoes has been used. And Dhaka is a highly densely populated country, yeah, populated city, and Bangladesh is the most densely populated country in the world. So it's too much hard for the government or the authorities to aware people in such within such a short period But to be honest, they are trying their level best.
Yeah, yeah. I have no doubt it's a very difficult task, particularly in the highly dense urban areas. Dr. Hassan, has Bangladesh considered the use of vaccination in the fight against dengue?
Yes, yes, yes. Already there is a trial in ICDDRB. ICDDRB is an research organization of Bangladesh. This is, I think you might have heard the name. This is very renowned among
Mhm.
the world. ICDDRB has done a trial of a dengue vaccine, that is, and the trial result was very good. But we need the approval from the WHO. So whenever we get approved from the WHO of the vaccine, we will introduce the vaccine in Bangladesh.
Okay, so that's something we may see in the future. Um, Dr. Hassan, just to close, anything else you want to add about the situation in Bangladesh that we haven't discussed already?
In fact, we have discussed more or less everything
Okay,
about the situation
very
of
good.
Bangladesh.
Very
But
good.
one more thing I want to mention that as I am USCDC graduate on FETP, so I love to see the situation of the whole world, and we can see dengue is rising all over the world, including
True.
US.
That's right.
So I want to focus one point. I want to focus on that. We should focus on research because the world is the same. Whether I am now in Bangladesh, you are in USA, but tomorrow we can visit our countries, or tomorrow we can be at any other countries or any other place. So we need a secured place for the people all over the world. And dengue is causing so many deaths all over the world, including Italy. I have seen in Burkina Faso, in USA, in Mexico, in Brazil, the cases and deaths are very high.
Hmm.
Even in India. So we need integrated management or integrated control worldwide. And I think we should focus on the research too, because to develop a successful way of controlling dengue all over the world, we should focus on research. And particularly, I think Bangladesh can be a good place for all the researchers all over the world. And we will welcome them because our authority are very cooperative, our people are very cooperative, and we lack with funding, we lack with the facilities. But I will be very glad if the top universities of USA and all over the world, if they think about for their research or studies on dengue in Bangladesh, that would be very much helpful for Bangladesh and for the whole world. Thank you.
Very good. Well, I want to thank you, Dr. Hassan, for sharing your time and your expertise. And I want to thank you for getting up bright and early this morning to talk to me. Thank you, sir.
Thank you very much, and thank you also for inviting me to your program and for highlighting Bangladesh particularly because I think Bangladesh is a very small country all over the world, but highly populated and highly densely populated,
Mhm.
and this would be very good for us and for the whole world if we can develop a successful strategy for controlling Aedes mosquito and dengue. Thank you very much.
Yes, sir. Have a great day.
Thank you. Thank you. Best wishes for you too.